I'm Dr. Linda Hill, and I will be discussing the evaluation of the older patient for driving fitness. This presentation is brought to you by the TREADS program. Driving is an important means of mobility and independence for older adults, but as people age, they often experience impairments that can interfere with their ability to drive safely. As older drivers are impacted by reduced vision, cognitive impairment, and decreased strength, we as health professionals play an important role to ensure their well-being as well as the safety of others on the road. Patients and families rely on healthcare professionals to help with the transition into driving retirement. This course has been divided into 4 modules. We will begin with the demographics and safety risks of aging. At the completion of this module, you'll be able to understand the safety risks of older drivers and identify conditions that may put patients at risk for unsafe driving. We will then address screening and interpretation, where you will be able to name the clinical screens to evaluate patients' level of function for driving fitness, followed by management of outcomes, where you will learn about referral and treatment options for patients who require further evaluation. We will conclude with the reporting requirements module, where you will become familiar with the California DMV reporting methods and requirements. All resources mentioned throughout this tutorial can be found at the TREADS website. At the end of each section, there are questions for you to answer. Also, you will be given the opportunity to print a certificate of completion after the last module.
California is the most populous state in the United States, with the most people over age 65 and the most senior drivers. By 2030, 1 in 5 drivers in California will be in this group, and a large number of people over the age of 90 are still licensed to drive. Traffic injuries and deaths are one of our largest public health problems. Unintentional motor vehicle crashes are the second leading cause of death in older adults, only behind falls. Many people stop driving on their own long before a crash or before the DMV gets involved. However, at some point, almost all older drivers have to cross the threshold into driving retirement, and not all do so voluntarily. On average, most drivers will outlive their driving ability by approximately 7 years and will then be dependent on alternative transportation. Driving cessation should not be approached lightly, as it often leads to other health and social difficulties. People may lose their ability to remain vital members of their community. While making only 15% fewer trips to the doctor, they make 65% fewer trips for social, family, and recreational purposes. And this lack of contact with others is detrimental to emotional well-being. Isolation is significantly related to reduced levels of physical activity, resulting in declining health and substantial increases in depression. Unfortunately, older drivers are often in the news due to driving errors, including failure to yield, difficult left turns, and pedal error.
Police say an 86-year-old man behind the wheel of a fast-moving 1992 Buick he claims he couldn't stop plows through 3.5 blocks of a crowded street closed to traffic.
In less than 20 seconds, George Weller killed 10 people and injured more than 60. It is simply a fact of life. As we age, physical and mental changes can begin to affect driving skills. Older drivers may have decreased strength and reduced vision, and many people experience cognitive decline. In addition, medical conditions and medication side effects can directly or indirectly interfere with driving. The visual impairments associated with aging include a decline in both visual acuity and visual fields. While most visual problems in those under 80 can be corrected with glasses or surgery, in those over 80, even the best attempts leave nearly a quarter of people with visual impairment. Reduction in visual fields interferes with peripheral vision. Studies have shown that those with visual field loss in both eyes had crash rates twice as high as those with normal vision, and nearly 1 in 7 adults over age 65 display abnormal visual fields. Some of the diseases affecting vision include cataracts, macular degeneration, and glaucoma. Another often undiagnosed age-related driving disorder is cognitive impairment, causing memory loss, confusion, and dementia. Although only 3% of people aged 65 to 74 experience cognitive impairment, the rate increases to nearly 1/3 for those over 85. It's also reported that as many as 3/4 of dementia patients go undiagnosed by their primary care physician, and that 65% of dementia cases are not documented in outpatient medical records. In most primary care settings, screening and recognition of cognitive decline remains a challenging area in need of improvement. Aging can affect strength and mobility due to reduced muscle mass, and we know that osteoporosis and low bone density predisposes older adults to fractures. This general frailty and loss of mobility is exacerbated by diseases such as arthritis. While vision and dementia are frequently linked to motor vehicle collisions, being frail alone is associated with increased crash risk. Older adults also have increased morbidity and mortality compared to their younger counterparts. For example, a 75-year-old man is at least 4 times more likely to die than a 21-year-old man from the same collision. The same is true for females. This applies to their older passengers as well. In California, for residents 70 years or older, when their driver's license expires, the renewal application may be started online. If the driving record indicates a knowledge exam is required, applicants will be notified and may complete an open book, no-fail course from their home. To finish the renewal process, individuals must visit the DMV for a vision exam and updated photo. A license can be renewed for 5 years if vision and written tests are passed and there is no sign of cognitive impairment. The DMV also offers a limited term license for 1 or 2 years if there's a medical problem that is not severe enough to stop driving but requires closer monitoring. For example, in early dementia, when symptoms of cognitive decline may be present, but an individual is otherwise functioning well. Other medical conditions such as cardiovascular disease and neurological disorders can impact driving. These issues are not limited to seniors. They're just more common with older drivers. Driving recommendations and counseling should be provided to patients of any age with any of these conditions. In a survey of stroke victims, less than 35% reported receiving any advice about driving, and only 13% had any type of driving evaluation. In addition to changes in vision, strength, and cognition, we also tend to accumulate medications as we grow older. There are numerous medications that reduce the ability to drive safely when taken alone, and often the effects are multiplied as 2 or more drugs interact. Only 22% of those using 5 or more potentially driver-impairing medications said they had some awareness of the potential impact on driving, and only 19% said they received a warning from a healthcare professional. Of course, no driving discussion would be complete without mentioning the profound effect alcohol has on the ability to drive safely. There are more than 10,000 alcohol-related traffic fatalities each year. And while older drivers may drink and drive less than other age groups, they account for a fair share of these fatalities. In addition, a growing number of Americans over the age of 50 have reported using cannabis in the past year, which may impact their ability to drive safely. And cannabis is getting more potent, resulting in unpredictable effects. Like alcohol, Cannabis can impair attention, alertness, reaction time, lane tracking, coordination, and perception of time and distance. With aging, chronic medical conditions and medications are amplified by alcohol and cannabis. Drivers should refrain from driving after consuming either substance. Older drivers who are physically and mentally healthy do share certain strengths. Overall, they're more patient and take fewer risks. They have often been driving a long time and have more life experience to draw from. And they are usually more compliant with the law than drivers of other age groups. Many older drivers have also learned to self-regulate. They reduce their driving exposure by taking fewer trips and avoiding certain driving conditions. They bypass the freeway, avoid rush hour, or drive only during the day. And women tend to self-regulate more than men. Older adults also drive fewer miles each year. However, men across all age groups drive more than women. Beginning with drivers aged 70 to 74, there is a noticeable increase in fatal crashes of passenger cars. And drivers 85 and older had the highest rate of fatal crash involvement per distance traveled. Evaluated by age group, 2022 motor vehicle crash deaths per 100,000 population begin increasing for males at ages 75 to 79 and females at age 70 to 74. To summarize, people over 65 are the fastest growing population group, and by 2030, 1 in 5 will be licensed drivers in California. Motor vehicle crashes are the second leading cause of injury-related deaths for those aged 65 and older. Finally, areas of impairment common among older drivers include reduced vision, decreased strength, and cognitive impairment, which is often undiagnosed in primary care.